What is a retinal vein occlusion? This condition is relatively common, and there are two forms. One is that the vein, the central vein which supplies the retina, becomes occluded, or you can have a branch of that vein which becomes occluded. It's more common in people who are smokers, or if they have untreated high blood pressure. And until very recently there was no treatment for this, and it could produce quite dramatic loss of vision. Until very recently it was a condition which had very little treatment. One could apply laser, which was variably effective, but now it is possible to inject the drug that's used for macular degeneration, for example Lucentis or Eylea, which will have a very significant impact on improving the outcomes of retinal vein occlusions. The symptoms are, with a central retinal vein occlusion, quite a dramatic loss in vision, and if untreated, and if in a certain variety of retinal vein occlusion, one can develop new blood vessels on the retina, on the iris or coloured part of the eye, which can cause a massive increase in pressure. So you end up with an eye which is not seeing and is painful. These eyes can be treated with a combination of an intraocular injection of the macular degeneration drug Eylea or Lucentis, and this can kill off the blood vessels and often give some improvement in vision. But it also prevents the complications, for example the pressure going up in the eye, and patients developing a very uncomfortable eye. It may be in combination with laser photocoagulation as well. With what's known as a branch retinal vein occlusion, the vision can be impaired, and again this can be treated sometimes with laser, but much more commonly with injections of the Eylea or Lucentis drugs. These treatments have really made a huge improvement into the outcome of these patients. Up until relatively recently, nothing could be done.